There's a guy, a white guy, in a Carnival cruise, and then he was singing karaoke, and then he started singing Keith Sweat.
Mm-hmm.
I know what you're talking
about.
Yeah.
And I think the funniest...
whole crowd went.
Yeah. And it was just funny because everyone's like, oh, this is my 16th time watching this. Or like they have all these like different point of views. All right, ready? And now it's just, every point of view is just popping up on my TikTok. All right. Shina? Is that what you said?
Shay would be okay.
Shay?
Yeah.
Sick. All right. Shay, I know you've been through a little bit.
Mm-hmm.
Tell us what's happened to you and what is your hopes and what's going on with you. Well, we'll start like what's happened with you. How did you get to this point?
Well, I was a very rambunctious child.
Mm-hmm.
I climbed trees. I fell out of trees. I've done a lot of like rollerblading and stuff, so I do have like accidents and yeah, pretty much that. And then car accident that I've had in 16, 17. And then after that, it's just kind of been the same. I just deal with it.
So what kind of pain do you feel today as we're talking?
Well, it's not really pain. It's more of like a pull. Like I'm forced to pull in like the opposite direction because my body wants to pull in the other direction.
Got it. So which way do you feel like you're pulling right now?
Like right now, I feel like I'm pulling this way, so I'm like forcing myself to pull the opposite direction.
Like almost someone's like taking it and pulling you like that. Gotcha. So it's almost like somebody's playing tug of war with you the whole time.
Yeah.
Yeah. Do you have any headaches, back pain, neck pain?
I get headaches, and I get it. It's in my in my face, so it feels like somebody punched me in the nose, pretty much.
That's brutal.
Yeah.
How often are you getting those?
I know. I've been getting them pretty. I probably get it like once, maybe twice a day.
Well, so you have something every day?
Yeah.
That's crazy. For how long?
Oh, but I've had it since. What was that? I had it. Yeah, 2016, 17, because I was put on some pain medication for help with it. And then after that, I don't take the medication, I just deal with it.
So in 2016, 17, you had that accident. I know Dr. Bob went over the accident a little bit, but tell me what happened.
Okay, so pretty much it was a four-way stop sign. I was in the passenger seat, and we were at a stop and we were going, but the man decided to blow through the stop sign at 65 miles per hour.
Jeez.
And would it impact us? We rolled, and then we almost rolled into an apartment complex into that stuff. So
you got just slammed.
Yeah, I got the most of the injuries out of everybody in the vehicle.
So that's probably why your body feels like it's pulling this way right now, because the force went this way and it's trying to rebound back almost in a way. Gosh.
Yeah.
Low back pain too?
It's low all the way up to like here.
So your whole spine is just rough.
Yeah.
Right now. What are your hopes, expectations? What are you looking for with me?
Just some release tension. That'd be great.
Yeah. It seems like you just kind of learned to, just like him, you've kind of learned to live with everything.
Yeah.
And it's been a long time since you felt normal. Yeah. So today, are you feeling everything that you were just talking about? Like,
yeah.
Do you have a headache right now? So Ken punched you in the nose is what happened.
Yeah, pretty much.
Ken.
I got too close to the camera.
All right, well, let's take a look at you. Let's see. I'm going to just do some range of motion test, kind of like him. What do you feel like has been the hardest part for you? I mean, that's a pretty traumatic accident, but what do you feel like has been the hardest part for you having to live with all this now?
It's just the walking.
The walking?
Yeah, because when I was in the car crash, right side of my body was paralyzed, so I had a bad stutter and memory loss. But whenever there's a sharp pain in my spine on the right side, it shoots down my leg, and then I can't walk. Like, I have to just sit until I get my nerves back.
Jeez. Have you seen a chiropractor before?
Yes, I have seen it before through the car accident, but I had to move to Idaho because I couldn't stay in Las Vegas at the time, so I had to stop all procedures with that stuff.
Have you gotten treatment at all since then?
No.
So this is the first time in a long time?
Yeah, first time in a long time.
Well, we pray for miracles and we hope that something happens today.
Oh,
You know?
well, I'm excited.
I'm excited for you too. On that note, I want to see you walk.
Okay.
So let's have you walk down to this sign there, and then you're going to go all the way down this way.
Cookies.
Yeah, so it seems like your right leg is just kind of reaching over.
Yeah, I've had an injury with my ankle in like the 5th grade, so I literally walk like this.
Oh wow! What happened with the injury?
I apparently, well, the doctor said I sprained it, but I pretty much like I felt like the whole tendon like snap and like crackle. But my mom just put it on ice, and then from there I've always been walking like this, like ever since.
Oh my gosh!
Yeah, so if I twist my ankle, it actually does hurt, and I can't walk or anything.
Oh my god! Okay, so you're a bunch of like different injuries just kind of compiled into one right now.
Yeah, so I have a waddle walk pretty much.
And that's probably also what's. So which ankle was it?
My right one.
Your right side. So that's also the right side that's hurting you as well too. So it may have started from before, the accident came in as well too, and just kind of shifted everything even more so. Let's have you look straight towards Ken. Turn your head to the right for me. Does that hurt at all when you do that? Stay right there. Nose is about, give it like 75, close to 80. We won't be seeing lovely boyfriend over there. Look to the left. This one, oh, you almost came this way. But this one's better than the other side. So when you look to the right, where do you feel the tension?
I just feel more like here, and then I can feel a little bit in my shoulder.
Okay, and then look to the left.
I don't feel anything.
Okay, gotcha. Look straight. Ken, go to the side. Let's have you look all the way up to the ceiling for me. Is there any pain when you do that?
Yeah, just a little.
Can you point to where for me?
It's mainly like right here at the base.
At the
my
base
neck.
right there? Okay. And then look down for me. Is there any pain when you do that?
Yeah, it's just the whole, it's like a pulling.
Okay. On the right side as well too?
It's in the, like both, so
On
it's like
both?
center.
Gotcha. Stand up for me as well. Let's have you try and touch your toes for me. Come back up, sorry. Scoot forward a little bit. I just don't want you to be this way. Yep. Now try it again. Okay. Come back up. What do you feel when you do that?
Nothing.
Okay. So it feels like one side just kind of gets like locked a little bit more?
Yeah.
Okay. It's because of like that right side as well too? Gotcha.
So yeah, so like when I'm bend, I actually kind of have to like put more on my left and my right.
Okay.
Yeah.
Got it. I'm going to do this too. And then, do me a favor, can you take your shoes off for me too? You mind if I take a look at your feet? Why
Yeah,
are
I'm
you
looking
laughing?
at you because I took my shoes off for the reason to show you, and he's like, no, just put your shoes back on. And
I don't
was
really
like,
ever
okay.
tell many people to take their shoes off, but when somebody says like they had this ankle thing happen
Yeah,
to them,
I want to.
you want
show
me to
them.
see that, right?
Yeah.
You're right. I was wrong.
Hey, that is the right answer. Let's have you go face down. You know, my wife called me, or she texted me the other day, and all she said was, "You were right." And I go, let me call. About what? Let your head go down. We have this joke that at first during our relationship, she was 85% right, and I was 15% right. It's skewed now. It's more like 95 and I'm 5. Feels like it's getting worse on my favor. Let's have you keep the left leg straight. Lift it up as high as you can go. Go back down. Is it hard to put your hand over here? Like to the side?
Oh.
Yeah, just like that. Let this relax more. Let the shoulders go. Yeah. Can you open this up? There we go. Okay. All right, let's try it again. Lift the left leg all the way up again. Go back down. And then the right side.
I can barely lift my
Okay.
right.
Try. That's it. Okay. All right. Let's try and improve that, yeah? So we're going to get started here a little bit. Yeah, there's a lot of tension in that heel and everything. Nervous?
Nope.
Oh, good. Dr. Abad said you were nervous. A liar. He is. He's nervous. Okay. I'm going to feel into your back, all right? I just want to feel a few things. I'm going to actually do other things as well, too. I'm going to go like this. Very fashionable. I'm gonna bend this knee like that. Does that hurt your back at all when I'm here?
No.
Okay. Yeah, so this right side definitely does not move at all. You feel that there?
No. Oh, well, yeah.
Yeah. Okay. So she also has a pretty significant curve in that lower back. I'm gonna loosen this a little bit more, yeah. Okay. So we're gonna do a few things that I'm gonna feel. Okay, so same thing like him. I want you to take a deep breath in, but when you do it, I want you to fill just your stomach up with air, and you're gonna tilt your pelvis backwards like this, okay?
Okay.
Take a deep breath in. Yes, exhale all the way out. Good, even more so. Deep breath in. I'm gonna guide you a little bit. Exhale all the way out. Yeah, right in through here. Deep breath in. Push, 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 push. More. Exhale all the way out. All of it. In. That's it. Exhale all the way out. Okay. Good. Take another deep breath in right here. Exhale all the way out. Good. Bring all this air all the way up. Deep breath in. Yeah. Exhale all the way out. Spread your shoulders, tuck your chin, deep breath in, right through here. Exhale all the way out. Expand the chest, deep breath in. Exhale all the way out. Good. Tuck down even more so. Now tilt this pelvis back and take a deep breath in and pull. Exhale out. That's better. Good. So I'm just feeling some things here. Keep breathing nicely. There it goes. Good. Try that again. Lift the left leg all the way up again. A little better. Go back down. Do the right side. All right. I know it doesn't seem much, but it's a little bit better. Nothing crazy. Okay. Grab the handles there. I'm going to see something like this again. We're going to see how this is. Good. Yeah, so you're stuck inwards like that. Yeah, easy. Yeah. So you see how like when I try to do this, like your whole pelvis comes already? So what's happening is that this part on your right side is stuck inwards. Yeah. That's too far. Yeah, all right, you ready? Table's gonna pop up underneath of you, all right? Here we go. I'm actually gonna use a few levers to help this out. So lift this hip up here for me. Good, go back down. And you're gonna do this one here, lift this hip up for me, go back down, all right. I'm gonna push right here first, okay? Good, nice and easy. I gotta loosen this up. Okay, right here. Any pain? No, good. Yeah, that whole thing. Okay. Still okay? I'm gonna go down to the other side now too. So we're going straight into this hip, okay?
Okay.
Right here. Good. Literally giving you butt punches. Lift the left leg all the way up again. Okay, and do the right side. We got some lift off, huh?
Yeah.
Good. Okay. I'm gonna push down. Good. Left leg up again. Nice. How does that feel?
That feels amazing.
Yeah, do the right side. Wow.
Holy crap.
All right. Okay. Let's help this on a little bit more. So we're on to something here. That whole sacrum is just pulling. So we're going to pull this entire foot, okay? Nice and loose on that hip. Yeah. Jeez. Okay. And then here too. Good. And then same thing now. Good. Left leg all the way up again. Yeah, right leg all the way up.
Holy shit. Oh my god. Excuse my language.
That's okay.
Holy shit.
Yeah. People are always like, nah, these tables don't do much. I leave them out of the videos because it just feels boring. Some people are like, I'll watch it. I'm like, well, not many people like that. I wouldn't watch it. Good. Okay, right here. Good. Good. Left leg up again. Wow. Right side.
Oh my gosh.
Yeah, okay.
Holy, I can lift my right.
Yeah. Okay, I'm going to match something here because I think your body's been so used to a certain thing. I'm going to open this area up a little bit more. So now since we realigned that pelvis a good bit, I'm going to open these muscles up for them to say, hey, we're okay to move. Let me open. Feel a little different than when you first were on it?
Yeah. I feel a lot of pressure
Yeah.
where your hand is.
So we're opening it more because since we realigned that pelvis more, the muscles just need to catch up, and we want to do this to help it up a lot. Left leg up again. Right leg up again. Yes. That's pretty remarkable, honestly.
It's blown right now with my right leg.
Let's have you sit up for me. And you know what? Actually, let's get you on your back. I'm gonna work on your feet a little bit and get off the spine for a second. That's good. Okay. So let's take a look. Yeah, there's not a lot of extension. Let the toes relax. Yeah, not a lot of movement. Yeah, that doesn't move. That doesn't move. Okay, so first thing we're gonna do here, this is talus. Talus does not move nicely. He's here. Good. Metacarpal next. Good. One more. Good. Wow.
Wow, that's amazing.
Yeah. Here too. Good. Let's get that heel to move. It's kind of what's holding everything. Just bashing your heel, you know.
Yeah, they put in a lot of work because when I walk, I depend on my left foot.
Yeah, bend this knee for me. I can feel it. It doesn't feel like it moves well. We want you to move well.
Yeah.
I mean, who doesn't, right? Okay. Okay. There we go. Bend this knee just like that. A little bit more. Thank you. Thank you. Right there. There we go. Sorry, I needed this to just be right. Okay. Pushing in just like that, okay? So I'm trying to lift this heel off. Beautiful. Here. Good. Awesome. Keep your leg just like that. In a little bit. Nice. Good. Let this scoot up a little bit actually for me. Yeah, there you go. Keep going, keep going. Good. All right. Huh?
I could feel it like
Opening.
I could just feel that crunch when you move my ankle.
I'm gonna pull. Does this hurt if I do that? No. Ooh, yeah. And then let's separate. Oh, there it was.
No. Oh, sorry. This is. Oh, I felt that way.
All on the right?
Mm-hmm.
Take your time. It's okay.
Yeah, I had so much pressure on my right foot. It just.
What did you feel when I pulled?
It just reminded me of like of when I like twisted, but it's like a good twist.
Mm-hmm.
It doesn't feel crunchy, but it's like I felt that all the way
Yeah.
up my foot.
Things been jammed,
Yeah.
stuck in there.
It's been stuck like that since the 5th grade.
That's a long time.
I've never walked straight at all. It's just feeling all that release. I'm just like, oh my gosh. Is my foot still there?
Your foot's it's still there, I promise. I just want to check this knee now, is that okay?
Yes.
All right, here we go. Okay. Good more. There it is, okay. You want to sit up?
Okay.
Let's walk around a little bit.
Thank you. No effing way.
What do you?
I don't feel like, oh my gosh, I don't feel like I'm like this. Like I feel like I don't have to walk on my side anymore. I feels like I'm like,
You're level and you're trying to figure out how to walk.
oh my Oh, it's like I want to go back. I want to revert back to my walking, but I can't. Like go back. I'm not even waddling as much as I used to.
No, so part of it literally looks, no offense, but it looks like you're like Bambi, like trying to like.
Yeah, I know,
like,
right? Trying to walk. Yeah, because I've been always like, I've always been safe on my feet because of my ankle. So like, I'm always just walking like this. That's all I do, and I'm like.
Just walk a little bit more. That way you can continue to get used to it.
It's like I can press my big toe down because I usually don't walk with my big toe on my right. I always depended on like my last two toes.
I want you to walk out even further because I know like your hip, you're like so used to being on that hip in a weird way.
Yeah, and I don't feel like I have to do like the waddle.
Yeah.
Just like I don't feel like I'm waddling. Oh my gosh, that feels amazing.
Oh yeah, go ahead.
I'm about to get emotional. Like I haven't walked straight since the 5th grade. Like, oh my
It's okay if you get it. No, this is a part of the healing. This is 100% a part of the healing because your body's been through this for such a long time.
Man, I mean, I've had a lot of bodily injuries that I never went to the hospital for, so it's like I've dealt with it, but. Oh my gosh, I can walk straight. I feel like I just want to walk all day now.
Yeah. Well, a part of it is also we're gonna have to like start talking about different shoes as well too. But this is good.
Like it feels so amazing to walk straight. Like, man.
If you cry, it's okay.
It's just because it's been such a long time since I've walked straight, and it's always, and then just to feel walk in, I'm like, oh my gosh! I shouldn't get emotional, but it's like I never walked straight. I've always walked like I always felt like I had to be like dependent on my left side, and it's just oh my gosh, it's like I just want to keep walking.
It's okay. Hey, you know it's okay.
Oh my god.
And it's okay to it's okay to get emotional. It's a part of like what you've been through, especially like everything that you've been through. It's definitely a part of it, and it's a good thing.
Yeah. Oh my gosh, I needed that. It means so much to feel like I can walk normal again. I can finally rollerblade. I don't feel like I'll have to just pinky it out, rollerblade.
Yeah, right.
Just hope for the best that my ankle don't give out on me. Man, I needed that real bad.
I think you absolutely did. Just judging by your reaction, you 100% did.
Yeah, it's just been so painful a lot lately.
Yeah.
And it just feels nice to put my right foot just flat. I don't feel like I have to like do that anymore. Oh my gosh. I'm just thinking of 5th grade. All I get to hear of my walkie, changing shoes. I can't do this, I can't do that. And now I'm like, oh yeah, if I could learn to do a backflip, I would.
Let's check this out too. You ready? I want you now, let's see, look straight. So we just did the back, but turn your head again to the right. How does that feel now?
Hey, how you doing?
Yeah, so all the way from the bottom of your pelvis all the way up to the top of your head, there's a muscle that just is connected. So when it's tension on one side, it's not going to allow you to go this way. So you can see how much further you even went.
Yeah.
And look to the left. So that's why we do a lot of those drops, because sometimes it just takes your body a little bit to say, hey, no, it's okay, I can do this, I can push into it, where if we just go in and just try to crack you, and it's so like that. Like sometimes this is the best thing for it instead of like that. We like the though. I want you to lay on your back now though, for me. We're gonna add a little bit more into this. Doing all right?
Yep.
All right. Okay. So shoes are important because whenever you have too much of a heel, like on your shoes, your heel is a little bit higher, a bit higher than the toes. When that happens, it makes you push into the tips of your toes and not on the heels anymore.
Yeah.
So there are brands, and we have links to different functional footwear that I do recommend for you because it'll allow your body to actually be planted better. So you feeling like your feet are on the ground is the way it's supposed to be. But most shoes aren't built that way.
Yeah.
Most shoes are having this point in your toes, which, like when you look at your toes and you look at your shoes, why is there so much more of a point on your shoes? It's just for looks. That's it. So we want it to match, and we want the heel to drop so that you can use more of your foot, and then it goes all the way up to your head. Ready? All right. So I'm going to pull on you a little bit. I'm going to use my hands, just because I want to get a lot of that compression out. I do feel that compression whenever I was feeling it through your spine earlier. And there's a lot of things that are happening here. Especially right there. Okay, we're gonna go occiput here first. Let me do this. Okay. So I'm gonna take this hand, just like that. I want to see something. I'm sorry. Something I'm feeling in your spine. I want to confirm before I do something. That is what I thought. Okay. All right, ready? So we're gonna do this a little differently. I'm gonna take this hand like this. Here we're gonna go down like this. This thing is in my way. You mind if I touch right there?
That's fine.
Okay. That way I can just do this. All right, thank you. Right in there. So now that we have a little bit more rotation on this, it's a lot easier. And on your right side, it's a little bit shorter. We're gonna go to the left. Okay. Here we go. That's better. Yeah. Let this muscle right here relax as much as you can. And drop this down a little bit more. Easier. Good. Just like that. So we're just locking them in this way. Good. Oh my God.
Oh, that was nice. That was so nice. That was so good. Oh, that's so nice. I feel all opening up. Oh my God, I needed that.
So one of the biggest things that we saw with you, and this is why when I was like pressing on you, I could feel like something which is like, it doesn't want this lateral, like this bilateral pull. This left side is a lot further dropped down and you can kind of see it, and it's also pulled back, so we wanted to turn it the opposite way, to push it this way. Yeah, how are we doing?
Pretty good.
Yeah?
Yeah, let's do good.
All right. Good. Let's now have you sit up here for me. 1, 2, 3.
Thank you.
I'm gonna take this now. All right, scoot down a little bit towards your feet that way. So what we're gonna do next is open the rest of this spine right in through here, so I can feel all this tension, especially like right in there. I can feel that, and I'm gonna open this up this way. All right. There we go. There it is. Okay. And I'm going to use this just like this. So I'm going to take this arm over this one over that one, head down for me. Slouch just like that a little bit more. That's it. So right in this lower spot, I can feel how much tension there is. There's also this compression that happens, and we want to take that away. So right side's up, left side's turned. Good. Curl more, bend right from there, and then let's go backwards this way. Keep everything good. Right here, loosen the shoulders. There it is. Wow.
That felt so good. Oh I'm like, oh, I needed it.
I mean, it's been years since you ever got an adjustment.
Yeah.
Yeah. How were the adjustments when you went to the chiropractor?
Oh, it was just like, he was just like, oh, what's hurting? I'm like, oh, this hurting. He's like, okay. And then he would just crack and then like pop and then be like, okay, you're on your way.
Ah.
And then I'm just like, okay, so what do I do now?
Mm-hmm. Nothing.
Yeah.
Doing good? Mm-hmm. You need a minute to process, or are we okay?
Oh, no, I'm good.
Let's sit up here now for me too.
Thank you.
Ow. Good. Okay. So I want to open up this top part a little bit differently. So I'm gonna have you place your hands behind your head now.
Like this?
Just like this, yep. What I'm gonna do, I'm gonna be contacting in between, like this. I'm gonna put my hands in, we're gonna
Okay.
throw you down.
Hey.
Yeah. Let's see if your body can't take. I have a feeling it can. We're gonna do this. Tuck this down a little bit more. Bend from here. Like bend, 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 bend. Oh yeah. So there's not a lot of movement in this area whatsoever. I gotta get this out because it's gonna bother me whenever I'm putting my hand through. Ready? So let's curl forward more. Good. And then let's have you lay back a little bit. That's good. Okay. Yeah. Here we go. Right to the side. Yeah. Good. Let your shoulders unwind. Let your legs relax. Good. Head back on me. That's it. Deep breath in. Exhale out. Chest up. Yeah. Ooh, wow.
Oh my gosh. Oh, that was amazing. Oh my gosh. Can we have that again? Oh.
Let's go again right now. I'm just kidding.
I'll be like, round 2. Oh, that felt so good. Oh yeah, that felt great.
Mm-hmm. So we wanted to get a big move in like that. I don't normally do a lot of that, but really because like this whole middle back just felt so compressed and so tight in there that when we're able to open the whole thing.
Sometimes like when I sit, sometimes it feels like I'm bending forward and it feels like I have to like pull back. Like it's always a pull back. Oh yeah.
Yeah? Feel like I can breathe better?
Yeah.
Good. Heck yeah. That cleared out a lot. And into the ribs too. Okay. Good. Let's have you lay on your side now for me with the right side up. Yep, perfect. Good. Okay. And I'm gonna take this just like this. So what we're gonna do is your whole entire right side is just kind of shifted upwards like this. Can you see that?
Yeah.
So what we're gonna do is untuck that whole thing down. All right. Bend this knee just like this. Keep this straight just like this. Scoot this hip forward, down towards me. That's better, yeah. I'm gonna do this a little bit higher. There you go. Head back, yeah. Hand up. Right there. Right there. That is great. Yeah, so we can feel that, right?
Yeah.
As soon as we get into this part here, I want to do something a little different. We're gonna do this. Scoot all the way to the edge again. That's good. Put this on your left. I'm gonna take this now this time. And like that. Good. So I'm going to be moving you around. It's gonna feel like you're gonna fall, but I'm doing this for a reason to open this up. Okay, that's good. Easier in here. Good. Oh. Wow.
Oh,
yeah.
Oh, my hip. Oh yeah. Oh my gosh. I'm okay. Oh. Oh, okay. I think I'm okay.
Yeah.
Am I okay?
Looks like you're okay.
Okay, because I'm like, wait a minute, am I okay? Oh yeah, oh my gosh. It even got like the pressure point
Mm-hmm.
that's always on the right side. Like right there.
Mm-hmm.
Oh, that's amazing.
It's crazy. That was a tough one.
Yeah, because even when you were like getting in position, it's like I felt like that sharp pain,
Yeah.
but then it's like it went away. Yeah, just like that too. Like it lingered, but then it went away.
I was like, oh, I'm okay.
Yeah. Oh, okay.
Good.
Yeah.
This side now.
Okay.
Okay. I'm going to position you here, here, 1, 2. There we go. All right. And we're going to do something different, just like this. Hold this thing here. Hold this thing there. So this one is a little different because this part is just down a lot. But we're also going to hit L5 as well. So your whole body, I want it to roll. That's it. Gonna roll. Nice.
That was good too.
Mm-hmm. A little easier on that side,
Yeah,
right?
a little easier on the left side.
Yeah. That left side wasn't the primary issue. That right side, though, yeesh.
Oh yeah.
All right, let's have you sit up now for me. Face towards the way we started with Ken. All right. There we go. Now we want to adjust up into the neck here. I'm going to take your head like this. I'm going to take it like this. Good. Here. So I'm feeling a lot of tension, especially in this lower part of that neck. Do you feel that a lot?
Yeah.
Yeah. Yeah, like real low. That's where we're feeling it. Do me a favor first. Go on your back one more time.
Mm-hmm.
Your other back.
What? Oh.
Yeah.
Other back.
Yeah.
So
Just like that.
360.
Yep. Scoot down a little towards your feet and then bend your knees for me. And let me see this right here. Hold, okay. A little bit firmer, that's it. I'm gonna lean just like this. Better. And we're gonna push in. I wanna push down. Good. Easier. Good. You need a little bit more extension. Good. Okay. Now let's have you sit back up again. Okay. Just wanted to clear that out first. Now, let's get into here. Let's do this one more time. Feels good. That feels good. Yeah. Just keep coming back to this lower spot. Do you crack your neck?
Yes.
Yeah, I can feel that.
Mm-hmm. Especially to the left. Because I can never get it on my right.
Okay. So you crack this way?
Yeah, I go like this and then I go like that. Yeah, terrible position to pop.
She even says, "Hey, you want to hear my neck crack?"
Yeah, because I feel it's just it hurts when I pop it, but it feels like it's just that's the only way to relieve the pain temporarily at that moment.
Yuck. Okay. All right. So the reason why I keep touching, because there's a lot of things. So when somebody is their neck is just so hypermobile because you crack it yourself, it gives us some issues because we're like trying to figure out like what the heck is it telling us because it's so loose.
Yeah.
But not loose in a good way. not loose like a goose, but just loose. Scoot forward. Okay. I'm gonna climb behind you. And we're gonna go down like this. Sit up straight now for me. Lean back on my leg. Let the arms come down to the side. Uncross. Yes. Okay. So C6, C5 this way. Gonna come like that. Easier. All right, nice and loose in here. Better. Here.
Oh, that was amazing. I know. That's oh my God! It's just opening up right now.
Good.
It's like, oh.
Take your time. That was insane.
That was a good crack.
Yeah. On that right side.
Yeah. Oh, I could just feel it like opening. And I could feel it in my nose because that's usually where I feel like my headache's at.
Yeah. Right where Ken punched you.
Yeah.
Unbelievable, Ken.
Okay.
Is that headache releasing?
Yeah.
Yeah. That feels better. Good. And on your back now.
Yeah, this time my back, not my tummy.
Yeah. And I just want to check this neck again. Good. Bend your knees. I like that better. Oh yeah. So remember like this thing that was on that right side? It's not there anymore, which is nice. Okay. Just a little bit here. We're gonna get a big pop. Who knows? But. Okay. He's here. Good. Bend. Up. Chin up.
Oh my gosh. Oh, I almost forgot to breathe.
It's okay.
See, even though you popped it that side, I could feel it like right here. That feels, oh my gosh. I can't, it just feels like I'm opening my eyes and I see like the good plain field with the farms and the sheep.
You're in a pasture.
Yeah, pretty much. Oh, that was good. Yeah, that was good.
Good. One more, yeah?
Yeah, I'm just like,
Feels good. All right. There's a lot that moved on that right side
yeah,
today.
that crunch though.
Even so, really that in the neck, that left side was a lot.
Yeah.
The neck was originally what she wanted to see you.
Lift your head all the way up. Good, and down. What got me into this whole chiropractic thing is that I saw a chiropractor adjusting a neck, and I looked at him, and I was like, I could do that better. That's all I thought. You know?
Yeah, that's
I don't know
usually-
how to, but I feel like I could do it better. All right, nice and easy, okay? Let's loosen the traps in the shoulders. Good, easy. In through your nose, out through your nose, lips and teeth together. There it is. The last bone in your butt, right where your tailbone meets your spine, I want you to think about that area and I want you to open it in your mind. Picture the fibers opening. Take a deep breath in. Deep in through it, into the spine. Yeah.
Oh my God, I've been waiting for so long for that. Ooh. Oh, I feel it open all the way.
Yeah.
But mainly like where my shoulder blades is.
Mm-hmm.
That's where it's like opening it up mainly at. But I felt it all the way.
Yeah.
Oh, that felt so good. Oh my gosh, that felt so good. Oh, I need a spine adjustment like that, like all the time. Because I've been telling him, I'll be like, I just feel like I just want somebody to like detach my head from my body and then like readjustment and then put it back.
Mm-hmm.
Oh.
It's kind of what we try to do, right?
Yeah. Especially like where the base of my neck, I feel that opening up too. Cause of like, that's where usually I pop. Like I put pressure and then I pop my neck.
Yeah. So the reason why you felt it a lot, so that first adjustment that we did this way, that lower part was so shifted off to this right side that you always felt it here. That's why in that right side, you not only felt it here, but you felt it down into that shoulder blade. It's because everything on that neck was shifted like this. And so when it's shifted like that, it causes a lot of the traps, the rhomboids, everything just kind of move and compensate. So whenever we're able to restore that motion and bring it back center again, it can move again and not have a lot of that tension in there. Okay.
Yes. Thank you.
Yeah. Let's have you turn towards Kenneth. And let's have you retest. Turn your head to the right. 100%. Left. Let's go. Stand up now. Oh, actually, stay there. Look all the way up to the ceiling. How does that feel?
I feel amazing.
And down to your feet. Yeah, how does that feel?
Oh, that feels good. Oh, yes.
Let's have you stand up now. Move forward and try and touch your toes again. You don't do the weird thing anymore.
Yeah, because usually I'm like, oh my God, I don't have to like favor my right side anymore. I'm like head, shoulders, knees, and toes. Oh my gosh. And I can feel like, because usually when I put my feet together, my right is always like, it feels like it has to be like this. But I could put both of my knees and my knees are connected and my feet are connected. Like usually it's like that.
That's what I was asking what you were doing earlier, like, because it's like that weird hitch. Let's have you walk this way, all the way down to the side and come back. How are we doing?
Oh, that's good.
Step it out, there you go. Don't be afraid of it.
I still want to revert back to like waddling, but you don't have to. I don't have to anymore.
Your muscles have been so conditioned like that for so long.
Yeah.
That's why I want to do it. So we have to train it to do these different things.
Even my ankle doesn't hurt either. Like usually it's like that pop every time I walk, and it's like I don't feel that at all. Oh my gosh. The fact that I can I'm sorry, I'm blown because I could never really do that with it. I'm always like, I always favored my left because of my right. And now I'm like, I feel even. I don't feel like I'm like lopsided.
You look even. You look like.
I'm like, I can feel that I'm even. It doesn't feel like I'm doing this or like leaning or anything. I just feel straight. Thank you.
You're so welcome.
Oh my God.
How's your headache right now?
It's not even there anymore. That's like good. I don't feel it like, because usually when I have the headaches, it will travel here and then it will go to like the nose area, and I don't even feel that at all. It doesn't even feel like somebody punched me in the nose.
How's the lower back feeling?
Oh, it feels good. It doesn't feel like, because usually if I'm standing like this, usually after a while I'll start doing this motion, but I don't feel like doing that.
Yeah. Man, those leg lifts whenever you first started were nuts.
Yeah, I know, especially the right, because I was like, I don't have strength in my right to lift it. And then you lift it, I was like, oh my God. Man, it's been such a long time.
I gotta say, it looks like a weight just kind of just.
Yeah.
Like your, I don't know, true version of you is like coming out now.
I just feel like, oh man, my baby is gonna love me when I get home. I'm gonna definitely run after them now without feeling like I want to break my ankle.
Hey, I'm so happy for you. Thank you guys for
I'm
coming to see
happy
us. Yeah.
myself. Oh my gosh, thank you so
Yeah,
much.
you're welcome. I'm so glad. Yeah, I'm glad you
I know,
decided to bring her.
At least the first time, or at least with somebody you trust. So
Yeah.
there you go.
Well, you guys are more than welcome to come back whenever.
Oh, yeah.
To get in is a lot easier this time because the first initial visit's always the toughest, but the returning visits are like you can
Usually.
schedule
Yeah.
the next couple months if you wanted to.
Okay.
All right.
All right.
Get the blocks from us. Get the different shoes. We have the links in there, and then I want you also guys to start walking backwards.
Yeah.
It's going to help you open up those hips, and then watch out for our subscribe to our membership things because we're going to be putting stuff up there.
Okay.
All right.
All right.
Thank you guys.
Thank you.
I'd love to take a picture with you before you guys leave up